Yo, what's good, everybody? Good morning. Today's video is going to be about AML, other known as Acute Myelogenous Leukemia, but I'm just going to keep referring it to AML because it is easier to say. Okay, so just a quick overview. AML is an acute leukemia of the myeloid lineage, and it is characterized by rapid proliferation of immature myeloid cells that accumulate in the bone marrow. And this accumulation is going to disrupt normal blood cell production, which can lead to bone marrow failure. So, why does NBME love to test on AML? Well, it's because there's a classic peripheral smear finding. I'm sure you guys can all guess that I'm talking about R rods. And it also includes an important subtype, APML or APL, that causes DIC, which is obviously like one of the worst things you can get, because you literally die so easily from that. So what does acute mean? So the acute refers to the presence of immature precursor cells, also known as blasts, right? And acute leukemias, because they're so immature, like they progress rapidly, and they um they just progress rapidly compared to like chronic leukemias, in which in chronic leukemias mature cells are involved and they have a slower course. So again, AML, they arise from myeloblasts, which are immature cells of the myeloid lineage, and these abnormal blasts, they proliferate uncontrollably and crowd out normal bone marrow cells. So, and as these myeloblasts they accumulate in the bone marrow, they're gonna replace the normal hematopoietic tissue, and this is gonna lead to decreased production of red blood cells, white blood cells, and platelets, and you are pretty much gonna get pancytopenia. Now, okay, one thing to note is that on the questions for NBME, you will not always get questions that have pancytopenia, which I know is weird. But it makes sense, right? Like if your bone marrow where everything is created is being overcrowded, then everything else, like normal hematopoiesis is gonna go down, right? And so it is like, keep in mind pancytopenia does exist in AML, but for some reason on the questions it's not always like that. So some of the clinical consequences that you can see as a symptom of pancytopenia caused by AML is fatigue, weakness. You know, having the neutropenia will cause infections, and having the thrombocytopenia is going to cause easy bruising and bleeding. And yeah, so here are some of the symptoms. This is a peripheral smear of AML, and it's not the most like, you're gonna see a lot of, like, when you're studying for the step 1, you're gonna see a lot of types of AML pictures, but yeah, you can see like this pink, like almost like rod-like structure. That's the R rod, right? And then you just gotta remember that the R rod is composed of myeloperoxidase. Okay, I'm sure you guys have heard of that. So yeah, just remember that it is composed of myeloperoxidase, and I feel like that is yeah, just like, definitely you have to know this picture. Like, this is the most important thing from this presentation. Like, you have to know this picture, or else you're gonna get the question wrong. Yeah, but the R rods, they are needle-shaped cytoplasmic inclusions, and they're formed by the fused azurophilic granules, right? But yeah, this is the picture that you want to memorize, okay? And you can kind of see like there's a high nucleus to cytoplasm ratio, right? So just also kind of keep that in mind. And then this is the subtype. This is the acute promyelocytic leukemia, also known as APL. And the subtype that you have to know, that there's a translocation, right? The T between chromosomes 15 and 17. This, you need to know the T1517 relates to APL, which is a subtype of AML. Okay, so this is very important. There is a high risk of DIC, and the reason why APL causes DIC is because abnormal promyelocytes, they release procoagulant substances, which can activate the coagulation cascade, which is going to lead to DIC. And once you have DIC, that's like a medical emergency. Like your chances of surviving it is not the highest. Diagnosis and treatment. So AML is confirmed with bone marrow biopsy. And it usually shows more than 20% myeloblasts. So on the exam, if they give you any question that says like, oh, this patient has like 30% or 50% blasts, like you should be thinking of AML. Okay. And as for treatment, obviously there's chemotherapy, but the one that you should know for the exam is definitely the all trans retinoic acid, or ATRA, because or also known as vitamin A. And this is important because it's going to cause maturation of leukemic cells into mature granulocytes. Okay, so yeah, remember the all trans retinoic acid, very, very important, very important. And then it's also important that you know like how this affects the cell. I think if I remember correctly, it's something about like maturation in the nucleus or something along those lines is what I remember. Yeah, let's do the sample question now. Yeah, take a second, take a minute or two to read it and answer it. I'm gonna show the answer in 5 seconds. 5, 4, 3, 2, 1. Okay. So the answer is A. So, okay, occupational exposure to which of the following most likely contributed to the development of this patient's condition? A 55-year-old man presents with a 3-week history of night sweats, fatigue, weakness, decreased appetite, and painless swelling in his neck. He owns a printing business and reports frequent occasional exposure to paints and industrial solvents. Physical examination reveals enlarged tender axillary and inguinal lymph nodes. Laboratory studies show a leukocyte count of 45,500 millimeters cubed with 80% large blasts containing R rods. Occupational exposure to which of the following most likely contribute to the development of this patient's condition? Okay, so reading from the top, bottom up, right? Laboratory studies show a leukocyte count of 45,000. Okay, so like I was saying, I know that this is a pancytopenia. AML causes pancytopenia, but obviously this is like leukocytosis, right? So that's kind of what I mean. Like, be careful. Like if your definition of pancytopenia is that like all the, like all the cells are low, right? Like your blood cell count, your white blood cell count, like your thrombocyte, your platelet count is all low. Like you gotta be careful, okay? But you have this huge clue, right? You have this huge giveaway clue. It says 80% large blast. Remember what I said? If they say anything more than 30 or 50% blast, boom, you have AML, boom. And it also says R rods. Holy crap! Like they could have replaced R rods with something like let me see, with something like cytoplasmic, or like they could have replaced it with needle-shaped cytoplasmic inclusions, right? Something like that, right? So you just gotta, like, they gave it to you, but you definitely have to know that R rods are these needle-shaped cytoplasmic inclusions as well, okay? But boom, like just from this last objective finding, you know that they're talking about AML, right? But NBME, they're little tricks to you, feel me? So they're gonna switch up on you and be like, oh yeah, like we know, like we gave you that this is talking about AML, but now you gotta know what what occupation exposure causes AML, right? So they're gonna throw you in a loop sometimes, even if you know that they're talking about AML or whatever the disorder is. Sometimes you get the question wrong because they throw you in some bus and leave you to crash, to jump off the cliff. Okay, but hey, that's why you gotta do a lot of questions, buddy. Okay, so yeah, so yeah, benzene exposure is a risk factor for AML, and now you know that, right? Now you know, and you're not gonna get it wrong the next time. Um, and it's because benzene is metabolized in the liver, um, and it accumulates. And like, okay, so the benzene is metabolized in the liver, and its toxic intermediates are accumulated in the bone marrow, which causes DNA damage, chromosomal abnormalities, and malignant transformation of myeloid precursor cells. Perfect blast, right? And while we're on the topic, we should go over what these other things cause, right? Cadmium is associated with lung, renal, and prostate cancer. Um, Chlordane is associated with neurologic toxicity, and naphthalene is associated with bladder cancer. Okay, you gotta know at least D and E, bruh. Like D, bro, D comes up a lot. This naphthalene, I've definitely seen it before, and you gotta just know that it's bladder cancer. Okay, and then vinyl chloride also comes up. it it um it predisposes the patient to hepatic angiosarcoma, and it's seen in like PVC pipe workers. Okay, vinyl chloride, hepatic angiosarcoma, and naphthalene, bladder cancer. Okay, and benzene, AML. Okay, um, but yeah, that's. I hope you kind of like. I hope you kind of like realize sometimes that the NBME will like does throw you into a loop, and like even if you know what they're talking about, it's always like some type of like little information that like no one really gives like a crap about, but they're gonna do this. Okay, that's what's frustrating, but it's okay, you know. Like you can get this question wrong, but at least you know that it was AML, right? So, and then just the final summary. um yeah, just know about the myeloblast and R rods is AML, right? Pancytopenia um, is important, but question stem is usually gonna have like leukocytosis or something like that. It's gonna have like a high leukocyte number, and APL will cause DIC, or there's a risk or high risk, and you should also know that all transuranic acid is the treatment for APL. And like I said again, if they give you a question that has like more than 30 or more than 50% blast, like bro, boom, AML. Okay. But that's gonna be it for this video. Just wanted to like leave you with just another pep talk almost. I guess like if you feel like you're not good enough, or like you feel like you're not smart enough, well, the reality is, bro, you've already got to this point. You know what I mean? Like I'm assuming you're about to take step one, so I'm assuming you're almost done with second year. So like just be proud of the fact that you even got here, right? Um and like think about it, right? There's always a shortage of doctors, right? You're never gonna have enough doctors. I don't think so. And so and you're part of that small percentage of people who can call themselves, future physicians at least, right? So just keep that in mind if you're feeling like you're not good enough. You definitely are, because you've made it to this point, right? And I fully believe that, you know, no matter what you're going through, no matter what inadequacies that you might be feeling, that you got it in the bag, boy. All right, get in your bag, study hard, do a lot of questions. Like I said, look at this, do a lot of questions, because NBME, they don't mess around sometimes. You feel me? Like, they're gonna throw you in some random question. Like, they're gonna just give you some random thing. Okay, like, bro, I never heard of like benzene causing bone marrow cancer until I saw it on a NBME question. So yeah, keep that in mind. But yeah, hope you guys have a good rest of your day. I'm making this at 5:30 a.m. boy. But yeah, it's fun. All right. I'm enjoying myself. All right. Deuces.